Hi, I'm Swan, surgeon at Hendersonville Medical Center. Hopefully this video today will help you better understand chest tubes, why we put them in, what they do, and especially how to set up a PLEUREVAC. For the purposes of anatomy of the chest, let's think of it in three spaces: the central mediastinum, the right pleural cavity, and the left pleural cavity. The mediastinum is basically the middle. It contains the heart, the great vessels, thymus, and esophagus. The right and the left pleural cavities essentially only hold the right and the left lung. One important anatomic part of the chest cavity that will help you understand this is the difference between the parietal pleura and the visceral pleura. The visceral pleura is the thin lining that covers the lung, and the parietal pleura is the thin lining on the inside of the chest cavity, or inside of the chest wall. The space between the parietal and visceral pleura is the pleural cavity, and normally only holds about 20 to 25 milliliters of fluid. This is the space where pleural effusions form, a hemothorax could form, or a pneumothorax could form. It's very important to understand this if you want to understand chest tubes and why we place them. During normal breathing and ventilation, the intrathoracic space has a negative pressure. That's because the diaphragm moves down, the intrathoracic muscles contract and move the chest wall outwards, and this causes the space to become bigger, air goes in, and the pressure is negative. On expiration, the exact opposite happens. Air goes out because of positive pressure placed on the thoracic cavity. So an abnormal condition that would be inside the chest would be a pleural effusion, which is fluid inside of the pleural cavity, or a pneumothorax, which is air inside of the pleural cavity, or in trauma situations, a hemothorax, which would be blood inside of the chest cavity. When a patient comes into the hospital with chest pain, one of the first things they do is get a chest x-ray. On a chest x-ray, that pneumothorax can be seen because it appears that the lung is collapsed or deflated. You can see an air pocket within the pleural space. This condition can be lethal because, remember, there's negative pressure inside the chest. So if there is a small bleb that's ruptured or a tiny hole in the lung that's leaking air, it has nowhere to go except to stay within the thoracic cavity. As this air accumulates with every breath and negative intrathoracic pressure pulls that air into the pleural cavity, the air has nowhere to go. So it begins to accumulate in the pleural space, and the lung begins to collapse more and more. Over time, if not treated, and this air continues to leak and stay in the pleural cavity, the lung will be completely collapsed or compressed. Eventually what happens is the mediastinal structures will shift away from the side of the pneumothorax, and you'll get compression of the superior and inferior vena cava, and that's where a patient can become critically ill or potentially die. The pneumothorax compresses their ability to return blood to the heart. The heart can't then pump, and then that's when the patient dies. So removing the air in the case of a pneumothorax can be a life-saving procedure. The chest tube drainage systems, they all have three components. One is the chest tube itself. This is the soft psi-elastic tube that actually goes into the pleural cavity. The drainage system usually has three parts: a collection chamber that collects the fluid and allows measurement of the drainage volume. The second part is a one-way water seal chamber or a mechanical valve that lets the air leave the chest and prevents air from going back inside the chest. The third portion is a suction control chamber that limits the amount of negative pressure that's transmitted to the chest. This is one of the most important parts because it controls how much negative pressure is applied to the intrapleural space. Obviously, if you apply direct wall suction, upwards of negative 120 millimeters of mercury suction, you could potentially suck the lung out of the chest. So that's why it's so important to have a control system such as this PLEUREVAC system to control how much negative pressure is applied. A one-bottle chest tube drainage system is not used too often. Essentially, the first bottle becomes the valve, the one-way valve, and generally what's done is a tube is submerged to a depth of about 2 centimeters, and what that does is it acts as a valve. It'll take 2 centimeters of water pressure to push the air down through the tube and out. This essentially acts as a vent. You may see the fluid level moving up and down with respirations. This is called tidling. During inspiration, the water level will go up as the pressure becomes more negative, and the water level would go down or return down to baseline during exhalation. The problem with the one bottle system is that the one bottle is the water seal as well as the fluid collection bottle, and it can be challenging to keep the water level at only 2 centimeters of water because if you have a lot of drainage, you'd have to continually empty the drain and maintain it at 2 centimeters, period. In the two-bottle chest drainage system, fluid drains from the chest into a dedicated collection bottle. The air from the pleural space, continuing through the tubing that connects the two bottles, bubbles through the water seal and exits to the atmosphere. So this way, you can have one bottle to collect all the fluid, and the second bottle is essentially your valve, generally set at 2 centimeters of water. The three-bottle drainage system is what's most commonly used, and this is a good system in order to maintain control of the suction. When suction is required to increase the pressure difference between the pleural space and the drainage system, it is important to accurately regulate suction levels to avoid patient injury. If suction pressure is too high, the complications can occur, such as hematoma formation at the end of the catheter, or even tissue invagination into the catheter eyelets, essentially sucking the lung out of the chest. The third bottle of the chest drainage system can limit the amount of negative pressure that can be transmitted to the patient's chest. This is essentially how a disposable chest drainage system, the PLEUREVAC, works. The chambers of this one-piece disposable unit correspond to the bottles in the three-bottle system. Most of the one-piece disposable systems include a collection chamber in which the fluid drains and the volume of the rate of drainage can be measured. There's a water seal chamber that uses sterile fluid or a mechanical one-way valve to allow air to leave the patient and prevent air from entering the patient's chest through the chest tube. And there's suction control chamber that either uses sterile fluid or a mechanical device to control and limit the level of suction imposed on the patient. An easy-to-read, well-calibrated collection chamber permits the nurse to record the amount of fluid collecting in this chamber. Most drains allow the nurse to draw a line indicating the level of drainage and write the time on the front of the chamber. This allows all clinicians to assess the rate of fluid drainage from the chest. Generally, what I've done is when I make rounds and look and see exactly how much is in the drainage collection chamber, I'll write that number down, say 500 milliliters, since the last time I saw the patient. If I come back the next day about at the same time and the level is at 700, then I know that 200 milliliters came out of the tube within that 24-hour period. For me, this is the simplest way to keep track of the drainage in any chest tube. The water seal chamber is connected to the collection chamber and provides the protection of the one-way valve discussed earlier. The water seal is, in most disposable drainage units, is formed with an asymmetric U-tube rather than a narrow tube submerged underwater as in the traditional bottle systems. The narrow arm closest to the collection chamber is equivalent to the tube. The longer arm serves as the water reservoir. When the fluid reservoir is filled to 2 centimeters above the seal in the U-tube, it has the same effect as submerging the tube in the bottle system 2 centimeters below the surface of the water. In addition to providing the one-way valve, a U-tube design can also be used to measure pressure. When pressures on both sides of the U-tube are equal, the water level is equal in both arms. However, if the pressure on each arm differ, fluid moves away from the side of the higher pressure toward the side with the lower pressure. If the water seal column on the front of the chest drain is calibrated with markings, the fluid movement acts as a water manometer for measuring intrapleural pressure, providing additional assessment data for the clinician. Some units have an anti-siphoning float valve in the water seal fluid column that prevents the water from being siphoned out of the water seal chamber and into the collection chamber during situations that create high negative pressure, such as chest tube stripping. Dry seal chest drains. Some chest drains use a mechanical one-way valve in place of a conventional water seal. The mechanical one-way valve allows air to escape from the chest and prevents air from entering the chest. An advantage of a mechanical one-way valve is that it does not require water to operate, and it is not position sensitive the way a water-filled chamber is. A dry seal drain protects from air entering the patient's chest if a drain is knocked over. The suction control chamber is another safety device that protects the patient from excess suction pressure in the pleural cavity or mediastinum. Suction control mechanisms in one-piece drains are either wet or dry. Wet suction control systems regulate suction pressure transmitted to the chest by the height of a column of water in the suction control chamber. Like the water seal chamber, the wet suction chamber is an asymmetric U-tube manometer. The narrow arm is the atmospheric vent, and the large arm is the reservoir. The amount of negative pressure that is transmitted to the patient's chest is determined by the height of the water in this chamber, not the level of vacuum set on the wall. Dry suction control systems regulate suction pressure mechanically rather than with a column of water. Some dry suction systems use a screw-type valve that varies the size of the opening to the vacuum source, thereby limiting the amount of negative pressure that can be transmitted to the chest. These valves narrow the opening of the chest drain in order to adjust the level of negative pressure. Therefore, the total amount of air that can flow out of the chest drain is also limited. Thus, this type of dry suction control mechanism is impractical for patients with significant pleural air leaks. Dry suction control mechanisms are quieter and often easier to set up than wet units. But because the dry unit is silent, it is not as obvious that the unit is working properly without careful examination of the front of the drain. In conclusion, I hope this video has been helpful. I hope that it's helped you learn more about chest tubes and chest tube drainage systems. I wish you the best of luck on continued education. Please feel free to contact me if there's any questions. And thanks again for allowing me to be part of this education process at Hendersonville Medical Center. Thanks again. All right. Yeah, I think I'm just about ready. Okay. Unique, New York. Unique, New York. What do you want?
I want this. No, I want to make this video first.
Okay, guys, hold on. Okay, almost ready. A tarantula enjoys a fine chewing gum. A tarantula. Come over here. Whoa! Okay. Human Torch denied a bank loan. Samantha, do you think you can go in the other room for me for a little while?
Yeah.
Okay, thanks. The arsonist has oddly shaped feet. The arsonist has oddly shaped feet. Where was that thing?
Princess Pink Ball.
What?
Can't find the Princess Pink Ball.
Did you look in the closet?
Yes.
Hey, throw me the ball, Samantha.
Nothing.
Oh, wait, don't write in my notes. So there's a few things that cause a pneumothorax.
Oh man, I missed.
So the PLEUREVAC ends up having 3 contain. Whoa! What are you doing?
What are you doing?
Disposable chest tube drainage. With intrathoracic pressure being negative, then
Get some mouse in the kitchen. Mommy wants you.
Okay. Water seal chamber is basically the same. Oh, it closed off the...
Oh no.
Oh man, I hope it... Suction control chambers, another... Most of the time when you put in a chest tube for a pneumothorax... Alright, show me what you want to do.
I want to just walk in like this and then put my hand on. Hey, that's a funny one.
What you want to do? Come in here. Show me what you're going to do.
Hey, that's a funny one.
What's the matter? What's the matter?
Hey, that's
the matter?
a funny one.
What's the matter? Why is Samantha crying?
I don't know.
She's not crying anymore. I don't know. What are we doing now?
Oh, okay. Just keep this one. It's funny.
Are you going to write with this Sharpie? What are you doing with this Sharpie?
Hey, that's a funny one. Oh, wait, I didn't.
You're not even on the video.
Okay, let's start it over.
I don't know what's going on here.
Hey, that's a funny one. Oh, wait, what are we doing?
Wait a second. Is the video on?
Yes.
Is it on?
Well, yes.
How do you know?
Because, I just know.
Steps to set up a check. Ow!
Steps to set up a check. Ow!